As a staff, we get along really well. I have a few people that I know I see quite a bit outside of work. A lot of joking happens. I think we're a really friendly group of people and we all really like each other. The other side of that is we're all really good about teaching each other too. So I've learned a lot from a lot of my coworkers here. So that's one of the things I love about this office. One of the things that I really like about being as a hygienist and having the experience of being a dental assistant from before is I can explain things really well to the patients on how they work. Another aspect that I feel is different for me is I really don't like getting things done in dentistry. I don't like any part of it. I don't even like getting my teeth cleaned. So I feel really empathetic a lot of the time with my patients, and I can understand the people that don't like dentistry. And in most cases, people don't like going to the dentist. So it's a pretty common opinion, so I can usually relate pretty well with that. When the doctors are chairside, I feel like most of the time with Dr. Raleigh, he is making the appointment as fun as possible. He's really great. He's really making sure he's attentive. If a patient is nervous, he's really good about making sure he's keeping an eye on that, really attentive as far as that go. Dr. Amanda is awesome. She's who I've had work done with before. She's really sweet. You can hear her voice. A lot of older patients really love her, but I've had work done with her, so I know hers better as far as working, but I've worked with both of them chairside as an assistant. I think they do really good as far as focusing on what their patient needs, and the patients in the chair usually seem very comfortable. Common misconceptions that I see about coming to the dentist is that every time you come in, it's going to hurt. It shouldn't. It doesn't have to. Dentistry shouldn't be painful. Another one I've heard actually is, and this is a common one because people usually have toothaches, they need root canals, that kind of thing. So people always hear about how bad a root canal can be. And in my experience, the majority of root canal experiences in the dental chair as the patient have been good. The problem is we don't talk about those as patients because we only remember the ones that hurt. And so I try and teach my patients that a root canal is not necessarily going to hurt. We have digital radiographs, which is a lot less radiation to the patient. We also have digital cameras that show them what we're seeing, so we can teach them a little bit more clearly. Instead of showing them an x-ray, which they're not going to understand, we would show them a picture of their tooth and they can see the broken area. We can also use that to their benefit with their insurance company because sometimes they really need to see those pictures too. We are required for every 2 years of our license, I believe it's 24 credit hours as a dental hygienist. And a portion of those credit hours have to be with medical emergencies. So we do take continuing ed courses. There are a few here in Salem that the oral surgery office puts on for us. And then there's a convention in Portland that I usually go to every year. It's becoming more and more evident that overall your body, your health, they play a large role, and it is usually depicted in the health of your mouth. So if you have, for example, gingivitis and you have inflammation in your gums, that can indicate that you have inflammation in other areas. You can have inflammation in your heart, you can have inflammation in your blood vessels. They go together quite a bit. In the same sense, the systemic link to diabetes is very similar. The periodontal disease that you can have in your mouth is related quite heavily with diabetes. They kind of go together. So if your diabetes is uncontrolled, your periodontal disease can be uncontrolled and vice versa. And if you can get to the dentist and take care of some of that periodontal disease, that sometimes can help with your diabetes and vice versa. So if you're taking care of your diabetes, that can help with your oral health as well. So they go together a lot, and it's becoming more and more evident that the bacteria in your mouth play a large role with other systemic diseases. When I have patients in my chair, what my goal is to show them and to teach them what I'm seeing. So if I have an area of concern, I'm gonna tell them what I'm seeing, and then I'm gonna do my best to explain to them why I'm concerned about it. So that's usually how I use my education as far as teaching my patients what I'm seeing. The other area where I usually do a lot of it being a hygienist is home care. So I do a lot of reviewing how to, say, brush and reviewing how to floss and that kind of thing. Everybody could always use a reminder a lot of the time with where to go, even us. So I do that a lot, and usually I kind of make the conversation interactive. That's usually my biggest goal with education. Usually I try and understand where they're coming from. I like to get to know patients outside of their teeth. You know, they aren't just teeth. I'd rather really want to know what their life is like. That's why I got into dentistry. I don't love teeth. It's the people that I really want to meet and get to know. In most of the cases, it was a really good experience, and it was a very rewarding case. I had an older patient who had come from a home in the Midwest, and her family was here in the Northwest, and they brought her here because she was basically not being as well cared for as she should have been. And when she got here, it was definitely one of the most significant cases I've ever seen. And it took quite a few, I would say probably about 7 appointments with her to get her to a healthier state. with her gums, with her teeth. But as I continued to see her, I kept continuing to see improvements, less infection. She was feeling better, though she didn't like coming to the dentist office. She was still doing better. She was definitely much more chipper every time she came. That would be probably the one that stands out the most.